Hi everyone. In the yesterday's class, in the previous class, in the part 1, we discussed about the introduction regarding the antihypertensive drugs. So in that, we discussed about what do you mean by high blood pressure, and we discussed about what do you mean by blood pressure, and what are the normal ranges. What do you mean by systolic blood pressure, and what do you mean by diastolic blood pressure? We discussed. So at the same time, we also discussed how the blood pressure is regulated in the body. So that is nothing but what are the neuronal mechanisms for the regulation of BP, and what are the long term regulation of blood pressure. So that is nothing but renin, angiotensin, aldosterone system. So along with that, other hormones that are responsible for the hypertension also we have discussed. Okay, so in the in the next class we'll continue with the types of hypertension, and we'll discuss about the various pathogenesis involved in the hypertension. Will continue. Okay, so before that we'll discuss one point. So that is nothing but, so uh, here blood pressure is depends upon two factors. What are those? So one is depends upon the cardiac output, and another one is depends upon the total peripheral resistance. Okay, so if cardiac output is increased, blood pressure is increased. When total peripheral resistance is increased, blood pressure is increased. So how the cardiac output is increased? So when heart rate is increased, when force of contraction is increased, when blood volume is increased, ultimately the cardiac output is increased. So this in turn increases the blood pressure. So how the total peripheral resistance is increased? So total peripheral resistance is increased due to what do you mean by total peripheral resistance? The resistance offered by the blood vessel, the resistance that is offered by the blood vessel against the blood flow. So how the blood vessel, how the resistance is increased? So when the blood vessel is narrowed, or any obstructions within the blood vessel, so this will increases the resistance to the blood flow. So this will causes the increased pressure on the artery wall. So this will increases the blood pressure. Okay, so in the next slide we'll continue with the types of hypertension. So what are the various types of hypertension? So there are here we'll discuss with the types of hypertension. So what are the various types of hypertension? There are two types of hypertension. One is essential hypertension, and also called as primary hypertension, and another one is the secondary hypertension. So here what do you mean by primary hypertension? Here we don't know the exact cause for the hypertension. So here there are many factors that are responsible for the hypertension. Either it is due to sedentary lifestyle, either it is due to smoking, or it is due to obesity, either it is due to stress, either it is due to alcohol consumption, either it is due to any other reasons, genes involved in the RAS genes, SNS genes, so endothelial dysfunctions, and all these are the causes for the primary hypertension. So there might be anything, but in case of secondary hypertension, so there is a exact cause for the hypertension. Either it is due to chronic kidney failure, or it is due to any endocrinal dysfunction, or it is due to drugs induced, either it is due to any heart defects. Okay, so these are the reasons why the secondary hypertension is due to any underlying condition. Okay, so in the next slide we'll continue with the blood pressure, American Health Association categorization of the blood pressure. So here American Health Association categorizes the blood pressure into the various categories, such as into normal, into elevated, and into stage 1, stage 2, and stage 3. So what is normal range? So when the systolic blood pressure is less than 120, and when the diastolic blood pressure is less than 80, so then it is said to be the systolic blood pressure. So when it is said to be the elevated, so if it is between 120 to 129, and if it is less than 80, so then it is said to be the elevated. So when it is said to be the stage 1 hypertension, if it is between 130 to 139, and if it is in between 80 to 90 in case of diastolic blood pressure. So if it is more than 140, if the systolic blood pressure is more than 140 and the diastolic blood pressure is more than 90, it is said to be the stage 2 hypertension. And so when more than 180 systolic blood pressure and more than 120 the diastolic blood pressure, so then it is considered as the hypertensive crisis. So here we'll discuss so pathogenesis responsible for the hypertension. So here there are many mechanisms responsible for the hypertension. So either it is due to sympathetic overactivity, or it is due to RAS overactivity, either it is due to endothelial dysfunction, either any vascular remodeling, either vascular fibrosis, a stiffening of the vascular blood vessel, or due to other vascular either thickening of the vascular blood vessel. Okay, and either it is due to renal mechanisms like renal stenosis, narrowing of the renal artery, or due to chronic kidney failure. Okay, so other genetic and environmental factors are the reasons for the hypertension. So these are the pathogenesis factors involved in the hypertension. So here, how the sympathetic overactivity can lead to the hypertension. So here in the yesterday's class only, while discussing about the regulation of blood pressure, we discussed so how the sympathetic nervous system increases the blood pressure. So here, according to the needs, when we are doing exercise, when we are doing jogging, whenever the physical work is increased, so according to our needs, sympathetic system is activated and the blood pressure is increased. So but in if the pathologically if the sympathetic system is overactive, so it can also causes the persistent elevation of the blood pressure. How it is? So this sympathetic system overactivity can increases the epinephrine and norepinephrine from the nerve endings. So these epinephrine and norepinephrine can act on the various receptors on the various organs. So it acts on the beta 1 receptors on the heart, and it acts on the uh, beta receptors, beta 2 receptors and alpha receptors on the blood vessels, and it acts on the beta 1 receptors on the adrenal glands. So here, by acting on heart, it increases the heart rate and force of contraction, and by acting on blood vessel, it increases the vasoconstriction. So by acting on the adrenal gland, it will increases the aldosterone levels. So all these when aldosterone levels is increased, blood volume is increased, and salt uptake is increased through increased salt uptake and fluid retention. So when the heart rate is increased, ultimately the cardiac output is increased, so thereby the blood pressure is increased. So once the vasoconstriction occurs, so this will increases the total peripheral resistance, ultimately the blood pressure is increased. So this is how the sympathetic overactivity can leads to the hypertension. Okay, so then other mechanism, RAS overactivity. So RAS overactivity is also leads to the hypertension. So we'll see. So here, so due to any abnormality, so when renin release from the kidneys is increased, when the renin release from the kidneys is increased, so this renin, what it do? It enters into the bloodstream, and it converts the angiotensinogen that is released from the liver into the angiotensin 1. Okay, so then this angiotensin 1 is converted into the angiotensin 2 by the enzyme angiotensin converting enzyme. So from where the angiotensin converting enzyme is released? From the vascular endothelium and also from the lungs. So what this angiotensin 2 is responsible for the various functions. So what it do? This released angiotensin 2 can act on the angiotensin type 1 receptors and type 2 receptors on various organs. So by acting on angiotensin receptors, so which increases the sympathetic activity, which directly acting on the kidneys and increases the water reuptake, and it acts on the adrenal gland and increases the aldosterone release, and it acts on the blood vessels and causes vasoconstriction, and it also acts on the hypothalamus and increases the antidiuretic hormone. So all this again leads to what? All this leads to the increased ECF value, and increased total peripheral resistance. So all this further leads to the increased persistent elevation of the hypertension. Okay, so we'll discuss what other mechanisms here. Vascular structural deformities within the blood vessel. Here endothelial layer of the blood vessel is responsible for the release of various uh, vasodilatory and vasoconstrictor mechanisms. So here uh, agents, what are those? Prostacyclins and nitric oxide is the vasodilatory mediators. So whereas endothelin is the vasoconstrictor mediator. So here once if any due to oxidative stress or due to any abnormality, so when endothelial damage takes place, so this can leads to the decreased production of these vasodilatory things and increased production of the prostacyclins. So this can also leads to the abnormality in the maintenance of blood vessel tone. Okay, and then so here other vascular remodelings. Okay, persistent elevation of the BP, hypertension also can leads to the vascular remodeling, so which causes the either thickening of the arterial walls, or which causes the fibrosis of the arteriolar wall. So thereby what happened? So which can narrows the blood vessel and increases the total peripheral resistance. So this is another mechanism. And the another mechanisms are the renal mechanisms. So one is either due to chronic kidney failure or due to renal stenosis. So all these are also leads to the hypertension. So here other hormonal and metabolic factors like excess Cushing syndrome and obesity, insulin resistance, so and polymorphism in the RAS genes, all these are so the other mechanisms responsible for the hypertension. Okay, so here we all know what systems overactivity can leads to the hypertension. So how can blood vessel diameter and how can the fluid volume can affect the blood pressure we discussed. Okay, so how the fluid volume can affect the blood pressure? So here how when the fluid volume capacity within the blood vessel is increased, ultimately if normal 5 liters that is flowed through the blood vessel, so if the volume is increased to 6 liters, so this will increases the pressure on the artery wall, right? So how blood vessel diameter is affects the blood pressure? So when it is narrowed, pressure on the wall is increased. So when it is dilated, the pressure on the wall is decreased. So here the two drugs, one can act by decreasing the extracellular fluid volume, nothing but the blood volume, and another drugs they can act by dilating the blood vessel. So those are vasodilators, at the same time diuretics. So diuretics acts by decrease the fluid volume. So whereas vasodilators can act by increasing the diameter of the blood vessel. Okay. Here, one more is other drugs are renin, angiotensin, aldosterone. So other mechanisms, what how can we control the BP? Either by dilating the blood vessel or by decreasing the fluid volume. So other drugs, so RAS inhibitors, RAS overactivity can also lead to the increase in BP. So how these RAS inhibitors can act? So either by inhibiting the renin release from the kidneys, either by inhibiting the angiotensin converting enzyme. So once the angiotensin converting enzyme is inhibited, angiotensin 1 is not converted into the angiotensin 2. So how the angiotensin 2 acts? It acts on the angiotensin type 1 receptors on the blood vessels and on the adrenal glands, and also on the kidneys. Okay, so here uh, we all we also can block angiotensin type 1 receptors. So here direct renin inhibitors can act, either angiotensin converting enzyme inhibitors we can use for hypertension, either angiotensin receptor blockers also can be used for the hypertension. So these all are considered as the RAS inhibitors. So one is vasodilators, one are the diuretics, and another one is the RAS inhibitors. So others responsible for other drugs responsible for the hypertension are beta blockers, sympathetic system overactivity. So that can also lead to the hypertension, right? So here the sympathetic efferents can act on the sympathetic neurotransmitters can act on the both the alpha receptors and beta receptors. So here we can use alpha receptors are associated with the blood vessel constriction, and whereas beta receptors can act on the heart, uh, and it acts by increasing the heart rate and force of contraction. So either we can use alpha blockers and we can use beta blockers, and also we can use the alpha 2 receptor agonist central sympatholytics. So these are the various antihypertensive drugs. What are those? One is vasodilators, and another one is the diuretics, and another one is the renin inhibitors and angiotensin converting enzyme inhibitor, angiotensin receptor blockers, and one more is the sympathetic blockers. What are sympathetic blockers again? Beta blockers, alpha and beta receptor blockers, and central sympatholytics. So these are the sympathetic blockers. Okay, so this is regarding the strategies for treating antihypertensive therapy. Okay, so what we discussed until now, here until now we have discussed about what is hypertension, so what is normal blood pressure, what are the various normal regulatory mechanisms, and what are the types of hypertension, and what is the American Heart Association categorization of blood pressure, and what is the pathogenesis for the hypertension, and what are the strategies for treating the hypertension we have discussed. Okay, so in the tomorrow class we'll continue with the classification of antihypertensives, and we'll discuss with the various individual drugs. Okay, so I hope you understood.